The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
Reading today, there is this new variant that I guess originated in Japan. And I don't know if Japan is a part of the world that we can sort of look to and see what's going to happen. I mean, every country is different in terms of how they handle these things. But this R1 variant, I believe it was first detected in Kentucky, our neighboring state, but now it's in 47 states and it spread rather quickly. It has elements of Delta in it. So your thoughts first on this sort of rapidly came across the pond.
Yeah, so it has been around for the better part of this year. Actually, the outbreak in Kentucky was at a nursing home back in March. And interestingly there, of the folks that developed COVID from this particular strain, they were much more likely to get it, whether they were a resident or a worker there, if they were unvaccinated. So it appeared to be somewhere in the 85 to 90% protective if you were vaccinated as either a patient or a healthcare worker. So I think on a certain level, that actually is somewhat reassuring because it does indicate perhaps that the vaccine can be really helpful at preventing the spread. Right now, there are some pockets of outbreaks where it seems to be spreading, but they're still really small, and it's not even really on the radar screen of the CDC at this point.
So no variant of interest, no variant of concern. It hasn't gotten to that point just yet. And from what I remember, or from reading the case, the nursing home event that you were referencing, Dr. During, one person was unvaccinated, and then it spread to 45 people. Do we know if those people were vaccinated, or maybe it was a breakthrough case?
The vast majority of the residents were, all but 8, and 6 out of those 8 actually got this particular COVID strain. So a really high attack rate amongst the residents, but there just weren't that many of them who were unvaccinated. So that was really good. A larger proportion of the healthcare workers were unvaccinated at that point. And so, while more of the cases were amongst the healthcare workers, it was because there were a lot more of them that had not yet been fully vaccinated. But again, of those who were, it was they were very well protected by their vaccination. So they were a couple other folks who were within 2 weeks of being vaccinated, so those didn't really count. They kind of threw those out just because their vaccine protection hadn't settled in yet. So they didn't count them against either the vaccinated or the unvaccinated populations in their analysis.
Okay. And also from what I've been understanding is that this has sort of elements of the Delta in it. It's sort of, I don't know, I could say sort of maybe a spawn of the Delta variant. Would that be safe to say?
Seems like a fair way to characterize it. Yeah. And then it has this specific mutation that's been seen in some other variants as well, that kind of changes the spike protein slightly, makes some people concerned that could help it evade the protection from the vaccine. But again, at least in this well-documented, well-analyzed case from the Kentucky nursing home, the vaccine, at least at that time, seemed to be holding up really well against it.
Right. I know there was some concern that this mutation specifically could bypass the spike protein in fully immunized individuals. What would you say to that, even though this is a speculative?
Yeah, it didn't seem to be the case in the outbreak at the nursing home in Kentucky, but I think that's really one of the big concerns of all of us in public health and in healthcare right now is, could there be a variant that emerges that does just that? And so, as we've sort of acknowledged from the outset, if and when that happens, we certainly do expect to be able to sort of pivot our vaccine effort especially on the mRNA side, and respond accordingly if we need to. So, of course, that'll be a whole separate debate, a whole separate discussion, and a whole separate effort to add that additional layer of protection should it come to that.
I know we've spoken about that before in terms of having to sort of pivot with the vaccine as we see these emerging variants, and that can happen pretty rapidly, I would say, because we have this technology, because we've been able to target these sort of the cardinal sign of the coronavirus and what's been changing. So can you just talk about, should this become something, the possibility of it evading fully vaccinated people, what do you imagine happening in terms of the technology shifting, changing to be able to target this R1?
Yeah, and that's certainly whether it's R1 or some other future variant, that's certainly one of the promises of the mRNA approach, is that we, with appropriate lead time, obviously you have to have time to sort of change over the production and focus it on a slightly different protein structure, but much more facile from traditional vaccine production, where it would potentially take years. In this case, we could potentially move things within months. So.
And Dr. Derving, I know we've spoken about this many, many times. It's people who are unvaccinated, they are hosts for the virus to grow. So this seems as if it landed in someone who was not vaccinated, or many, many people, and it started to grow and get more contagious, infectious. So your message to those who remain unvaccinated?
Yeah, I mean, the basic science behind that has to do with replication cycles. And for folks who are vaccinated, even though you might get COVID, your immunity tends to kick in and sort of arrest those replication cycles, versus folks who aren't vaccinated, where that just keeps going unchecked until your body's native immunity figures it out. And it's that time gap between, when the vaccine protection sort of arrests things, to when your own body's immunity, when you're not vaccinated, kicks in, is when all those different replication cycles can happen and the genetic mutations can emerge. And then at that point, they self-select to, okay, this is the one that seems to be the most lethal, the most contagious, the most able to survive and evade. And so that's the one that becomes, the emerging strain at that point. So, clearly, again, as we've been saying all along, having the immunity from the vaccine is helpful. It's helpful in so many ways, and this is just one more reason why it's important.
Would you explain replication cycle? What does that mean? Just sort of break it down.
Yeah, I mean, as you were mentioning earlier, sort of the spawn of the Delta virus, these viruses replicate over and over again, and you just think about each replication being a new generation, and they, tend to just be the same. They keep replicating the same virus, but occasionally a mutation will happen in the genetic structure, and if that mutation gives an advantage to that new strain or that substrain, then that will become the predominant one, and that's how these variants emerge. And that's you're talking about thousands of generations replicating in a relatively short period of time.
Right. I think we had talked about there have been so many variants, so many mutations. I mean, I don't even know what the number is even. And I don't know that. Do you know that? I don't know.
Check the CDC website. They have a really good ongoing tracker for all the different variants. And, right now the 800-pound gorilla in the United States is Delta, and, 99% of the variant that's circulating in the United States right now is Delta. So that doesn't mean there won't be another one emerge, but this is a pretty impressive strain that's got a chokehold on what's circulating right now, not really allowing other variants to get a foothold to speak of. But, as we start to enter the downward phase of the Delta, then that will create opportunity for other variants to potentially enter into the United States, either from other places or from pockets around the United States.
Wow. I'm hoping that that does start to, I mean, I don't know how you said it, your language, but it starts to sort of decline, or, but then however, right, that opens the door for others, or, and then Dr. Fauci had said September 15th on to MSNBC, I believe, that we can expect a monster variant coming our way. Like, he likened it to like doomsday. Do you have any idea why he would say something like that? Just in your opinion?
Yeah, I mean, again, as we were talking about earlier, I think that the concern is there may be a variant at some point that evades that either evades the vaccine protection or existing protection that people have gotten from prior COVID infections, and potentially ones that are even more lethal, more deadly, and more contagious than what we've dealt with so far. I think we continue to learn more and more each time we have a different surge in, what's driving these surges and how it's happening. But if you have the wrong combination of, the contagiousness, the concentration, how many viral particles are in our nasal passages and in our secretions, in our lungs, you get a virus that's more lethal and triggers a more deranged immune response and more people, vulnerable to dying from it. That's, I think, what he's talking about in terms of this monster variant that sort of brings together all these different features that could be even worse than what we've dealt with so far.
And then circling back to the R1, I mean, we don't know this yet, if this is something, even though it does have elements of the Delta variant, we just don't know if this could be the one.
Yeah, I mean, I'd say based on at least the Kentucky analysis, it doesn't seem as though it's that likely to evade the immunity from the vaccine. That didn't seem to be the case there, but it's not really out there on a wide scale basis yet in our population where there is vaccination and pretty decent natural protection now when you add those two together. So we'll just have to see. Basically, you think about the community spread and these surges, it's like a wildfire that's burning whatever is combustible, and at some point they start burning themselves out. So that Delta variant is on the early stages of declining, certainly here in central Indiana, but will there be another one that comes along and can burn the charred remains? And is there something, else that it can, sort of flare up and create bigger problems, even though we already have, the protection of having, been ravaged by the Delta variant or had, good vaccine penetration. So.
I got to take a look at those numbers at the percentage of infections. I mean, at one point it was 99, but perhaps it's gone down. I haven't taken a look in a while. And just there's only been about 2,200 cases of this R1 variant or R1 infection. Just to put people at ease, if you could.
Yeah, that represents less than 0.1%. We talked about the Mu variant a couple weeks ago. Similar. Less than 1 in 1,000 identified cases right now are from this new R1 variant. So really not on the radar screen yet for the CDC. Certainly, it's being detected occasionally, but again, the 800-pound gorilla here is still the Delta variant.
Mm. As you said, sort of ravaging the U.S. still.
Sure is. But again, we're seeing signs that it's declining, and that's encouraging to all of us during these very trying times.
One more thing I want to ask you. I had there was an article I was reading in Reuters, and there was a doctor who had said this is going to turn from a pandemic to an endemic. Okay, do we endemic? Where? I mean, is that, right. I mean, hopefully it'll decline from there, but.
Yeah. So the endemic, I think, just means you're going to have regular spread. It's going to be present in kind of indefinitely. I think as you and I have talked about before, what we're I think realistically can accomplish in the United States and throughout the rest of the world is taking this from what's been a lethal, scourge that is killing a lot of people to turning it into kind of a nuisance respiratory virus that really doesn't have the ability to kill as many people going forward. And we're going to accomplish that through, the vaccination, keeping people protected, plus, those who've survived the infection. And, we'll see how that goes over time if their immunity holds up. But when you add the combination of those two together, hopefully we're going to arrive at a point where truly vulnerable people are safe and protected, and those who are less vulnerable may pass the virus around, may get it, but not get severely ill.
Right. Just kind of an annoyance, as you said, or we had spoken about that. Just right. Well, looking forward to that day.
Yeah, it would be nice if this became just a normal cold virus at some point. So anyway, and of course, the treatments right now are imperfect. There's a lot of effort being made on the treatment side. So, hopefully, at some point down the line, we do have more effective treatments and can better save people from severe outcomes or death with that combination of prevention and treatment.
Yeah. Did you see today, just last question, I know you got to go. Did you see today the Moderna CEO said that this could be gone. The pandemic could be over this time next year because we'll have enough supply of our vaccine to distribute to the world. I know that there have been other vaccines in different countries that have been specific to what they've been producing, and we don't know the efficacy of those. And certainly many countries are struggling. But I was just curious about what made her or him say that.
Yeah, I think the current administration is trying to pull together the leaders on this to figure out how do we better distribute the vaccine, how do we better protect the rest of the world, and in doing so minimize the risk of these variants emerging. And so the fact that they are able to say they think they'll have their production to a point where they can largely cover the entire population of the planet, that's great news. I personally had not heard him make that comment, but that is obviously where we ultimately want to get. And then, of course, the next step in that is people's willingness to take it. So,
learn more and get more with Wish TV. Online at wishtv.com. And when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.